What was that? Yeah, we do cheap eye exams here. You like to have one done? Alrighty. So first I kind of just observe and take some notes. Yeah. You can get comfortable, have a seat. Okay. So have you been having any vision problems lately? Okay, yeah, just look forward. I'm just kind of looking. Okay, I'm just gonna go in and feel for any like swelling. Yeah, we have a routine eye check. I'll just test your vision, your peripherals, your visual focus, things like that, and then give you a diagnosis. Okay. Gonna feel around the eyes gently. Okay. Go ahead and follow my right hand with your eyes. Good. Okay. And the left. Okay. Get my marker. Yeah, I'm just creating a vision chart to further test your eyesight. Can you tell me, okay, first, we're gonna cover this eye, so yeah, just keep that covered. What is this letter right here? Good. Okay, can you read this line across this letter first? Good. This letter. Good. Good. Okay. Now can you read the first 3 letters right here? That. Now? Okay, good. And this one? Okay, can you read that one? Good. Okay, now cover this eye. And can you read this line all the way through? Good. Yep. Good. Correct. And this. That. Okay. How about this one? Good. This letter? Good job. Just gonna take a look real quick. Just maintain your focus on me. Just open your eyes real wide. Look at that. Okay. Okay, can you look that way? Look that way. Okay. Now you can look forward again. Can you tell me what this word says? Can you see it now? It's too light. Okay. Starting with this letter. What is that letter? Okay. Good. Good job. Okay. Okay. Good. Good job. Okay. Okay, just gonna test your depth perception, and whichever letter I point to, you're gonna go ahead and tell me what letter it is. So, okay. Good job. Yep. Good job. This letter. Okay. How about this one? Good. Okay. Gonna test your peripheral. So if you can just look at the bunny, tell me how many fingers I'm holding up. Good job. Good job. Good job. Keep looking at the bunny. Tell me how many fingers I'm holding up. And good job. Okay, follow the bunny. Now how many fingers am I holding up? Good. How about now? Good. Good. How many fingers am I holding up now? How about now? Good job. Close that eye. How many fingers am I holding up? Now? Okay. This eye. How many fingers? Okay. Tell me when my fingers go out of your view. Okay. Good job. Oh, clear. Alright, we're gonna test your color. Your ability to identify colors. So, can you tell me what color that is? How about that one? This one? Okay, let's see. Go ahead and take. I don't need these anymore. So, medium. Okay. Yeah, just keep looking forward. And I'm gonna test your colors. So. Yeah, the office manager has not vacuumed today. Alright, what's that color? Okay, this one. This one. This one. What is this one? This one again? Okay. Color. Okay. Go ahead. Actually, let me first get a couple. This up. Okay. What is this number? Okay. Can you tell me this number right here? Can you tell me now? This number. How about now? Good. This number. Good. And this number. Good. Again with the perception. Tell me what this number is. Good job. This number. Good job. Okay. Good. 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 Testing your eye movements. Can you look here? There? Okay. Alright, here. Good. Can tell me what I'm writing on the side of here. You can just, yep. Good job. What's news to you? Okay. Tell me which part of her face I'm tracing. Her eyes. How about now? Her lips. Her nose. Eyebrows. Jawline, head shape. ear, and her hair. Can you identify this herb? That is incorrect. Can you identify this one? That is also incorrect. This one? Okay. Just a couple more tests. Can you read this? How about now? Good job. Can you read the number right here? Tell me when you can see it. No? Okay. This number? Good job. Can you read this line? One medium egg. Okay. Correct? Okay. For the last test, you'll identify which animal is on the drawing pad. Okay. Correct. Correct. Incorrect. Incorrect. Okay. Yes or no? You can? Okay. That concludes our examination. So, your diagnosis, you are 20/20, so there's no need to worry there. But you are colorblind. Yeah. But it's okay. So, the price for that diagnosis, all the tests that I just ran, and the diagnosis will be $183. It is cheap compared to other places. And by cheap, I didn't necessarily mean it would be cheap for you, but I just have cheap supplies. Yeah, I'll take what you have as the down payment, $23.44. Okay. Just get that for you. For me, I guess. Okay. Let me count on the table. 10, 15, 16, 17, 18, 21, plus 22. 25, 35, 40. 142. Okay. One separated. Okay. And you have a good one. Bye bye.